According to the Maine CDC, last year more than 3,000 Mainers contracted a tick-borne disease. Most of them were diagnosed with Lyme. Now a new national strategy is kicking off to combat these rising cases in Maine and all across the country. As News Maine's Alex Haskell explains, health professionals are hopeful by making the fight against tick-borne illnesses a national priority, it will lead to better testing, treatment, and research.
We see rising cases of tick-borne disease every year.
Dr. Sean McCloy is a primary care physician at Integrative Health Center of Maine in Cumberland. McCloy says he sees patients sick with a tick-borne illness almost daily.
One of the problems of tick-borne disease, especially Lyme disease, is it can be difficult to diagnose. And so people can be symptomatic or be sick for months or years before they receive a diagnosis.
Dr. McCloy hopes one day this won't be the case, and it might not be, thanks to a new national public health strategy to combat tick-borne diseases.
There wasn't a national strategy.
In 2019, the Kay-Hagan Tick Act was passed by Congress and signed into law. The bill, co-authored by Maine Senator Susan Collins, required the Department of Health and Human Services to develop a strategy to fight tick-borne diseases such as Lyme.
At its core, the strategy sets out goals to better prevent, detect, diagnose, and treat tick-borne illnesses.
One goal is to develop and assess drugs and treatment strategies for these diseases. The effort could play out here in the state.
My hope is that Maine will be an active participant in finding out ways to better diagnose and treat diseases that are tick-borne.
This comes at a time when healthcare providers in Maine need more guidance on how to help their patients.
Right now, there are a lot of unanswered questions in the medical literature and the research.
With the federal government shining a light on tick-borne diseases, it may finally lead to answering some of those questions. In Cumberland, Alex Haskell, News Center, Maine.